Welcome to Satu Career 2.0 online nursing channel. This is AIIMS Nursing Officer Exam 2019 most important questions for Rishikesh exam. This video contains 50 MCQs. Before going to see these questions, please subscribe to Satu Career 2.0 online nursing channel. Please press the bell icon to get more notification about new videos. Come, let's go for the first question of this video. All of the following are the complications associated with oxygenation except option A, pure D orange, option B, Paul Berry effect, option C, Lorraine-Smith effect, option D, retinopathy of prematurity. Which is the right answer? The right answer is pure D orange is not the complication associated with oxygenation. Question number 2. A strategy commonly used to improve therapeutic communication skills is called option A, active listening, B, restating and clarifying, C, validating, D, process recording. The correct answer is process recording is not a therapeutic communication skill. Question number 3. Which of the following is the preferred site for intramuscular injection in infants? Option A, deltoid, B, rectus femoris, C, vastus lateralis, D, ventrogluteal. The correct answer, the most preferred intramuscular injection site in infant is vastus lateralis. Question number 4. Other name for collapsing pulse is option A, thread pulse, B, water hammer pulse, C, bounding pulse, D, pulse deficit. The right answer is water hammer pulse is also called as collapsing pulse. Question number 5. Anaphylactic reaction after administering penicillin indicates option A, an acquired atopic sensitization, option B, passive immunity to penicillin allergens, option C, antibodies to penicillin developed after early use of the drug, option D, developed potent bivalent antibodies when the IV administration was started. The correct response for this question will be option D. Option C, antibodies to penicillin developed after the use of drug. Question number 6. Acid-base balance is regulated by kidney by excreting hydrogen ion and electrolyte to maintain the option A, electrolyte balance in the body, option B, specific gravity of urine, C, filter the protein from the urine, option D, normal pH of blood plasma. The correct answer is option D. Acid-base balance is regulated by kidney by excreting hydrogen ion and electrolyte to maintain the normal pH of blood plasma. Question number 7. Erythema marginatum is seen in option A, drug reactions, option B, typhus fever, C, enteric fever, and D, rheumatic fever. The right answer is in rheumatic fever we can notice erythema marginatum. Question number 8. True about tracheostomy tube are all except option A, double tube, option B, made of titanium silver alloy, option C, cuffed tube for IPPV, option D, has to be changed ideally in every 2 to 3 days. The right answer is option D. Has to be changed ideally in every 2 to 3 days. Question number 9. Most important diameter of pelvis during labor is option A. Interspinous diameter of outlet. Option B. Oblique diameter of inlet. Option C. Anterior posterior diameter of outlet. And D is intertubercular diameter. The most important diameter of pelvis during labor is option A. Interspinous diameter of outlet. Question number 10. The dose of OPV given at birth in case of institutional deliveries is option A. 0 doses OPV. B. Initial dose. C. First dose. D. Primary dose. The first dose given at birth of child in institutional delivery is known as 0 doses of OPV. Question number 11. A patient of cystic fibrosis homozygous married a carrier heterozygous. The chances of developing cystic fibrosis in the offspring is option A 50% carries and 50% affected. Option C 25% carrier and 75% affected. Option C 75% as carrier and 25% is affected. Option D all are carriers. So which is the correct answer? Let's see the right answer. Option A 50-50. That is 50% carrier and 50% chance of getting affected. Question number 12. Operation theatre are sterilized by option A carbolic acid spraying, B washing with soap and water, option C formaldehyde, and D is ETO gas. The right answer is with the use of formaldehyde, the operation theatres are sterilized. Question number 13. It is true about Helicobacter pylori that it option A is a gram-negative spiral organism. Option B, it is a protozoa. Option C, it causes chronic gastritis in adults due to reinfection. Option D, treatment prevents gastric lymphoma. Which is true about Helicobacter pylori? The right answer is the treatment of it prevents gastric lymphoma. Question number 14. Regarding hepatitis E, it is true that option A occurs with hepatitis B. Option C is single-stranded DNA virus. Option C occurs along with HIV, and D increased mortality in pregnancy. Regarding hepatitis E, it is true. The right answer is option C. It occurs along with HIV. Question number 15. The most virulent plasmodium species causing malaria is option A Plasmodium vivax, B Plasmodium falciparum, C Plasmodium ovale, and D is Plasmodium malariae. The most virulent Plasmodium species causing malaria. The right answer is option B Plasmodium falciparum. Question number 16. Foot drop results as a result of injury to option A deep peroneal nerve, option C superficial peroneal nerve, option C tibial nerve, and D deltoid ligament. The right answer D peroneal nerve injury causes foot drop. Question number 17. 100% oxygen improves cyanosis in all except option A tetralogy of Fallot, B bronchial asthma, C. Eosinophilic pneumonia. D. Interstitial lung disease. The correct answer is except tetralogy of Fallot, 100% oxygen will improve the cyanosis. Question number 18. In freshwater drowning, the death occurs within 4 to 5 minutes of submersion due to ventricular fibrillation. Which of the following reason is responsible for this? Option A. Total asphyxia produced due to freshwater. Option C. Laryngospasm causing vagal inhibition. Option C. Hemoconcentration of blood caused by the osmotic pressure effect. Option D. Hemodilution, overloading of heart and hemolysis resulting in release of potassium. The correct answer is said to be option D. The cause of death is due to hemodilution, overloading of heart, and hemolysis resulting in the release of potassium. Question number 19. Leukocytosis is seen in all except option A. Brucellosis, option B. Acute myocardial infarction, C. Typhoid, and D. Diphtheria. Leukocytosis is seen in all the except typhoid fever. Question number 20. Vomiting center is located in the A. Hypothalamus, B. Pons, C. Amygdala, D. Medulla. The right answer is medulla, in which vomiting center is situated. Question number 21. A pinkish red fluorescence of urine with which lamp is seen in? Option A. Lead poisoning, B. Porphyria cutanea tarda, C. Erythromelalgia, and D is acrocyanosis. The right answer, option B. Porphyria cutanea tarda, in which a pinkish red fluorescence of urine with Wood's lamp is seen. 22. Pink frothy expectoration is seen in A. Pulmonary edema, C. Pulmonary tuberculosis, C is bronchogenic carcinoma, and D. Mucormycosis. The right answer, pink frothy expectoration is seen in. The right answer is pulmonary edema. 23. A child has got a congenital cataract involving the visual axis, which was detected by the parents right at birth. The child should be operated. Option A, immediately, B, at 2 months of age, C, at 1 year of age when the globe becomes normal size, option D, after 4 years when entire ocular and orbital growth becomes normal. The correct answer is the child should be operated immediately in case of congenital cataract. Question number 24. Respiratory distress syndrome in premature infants is due to inadequate secretion of which one of the following lipids? Option A. Dipalmitoyl phosphatidylcholine. Option B. Sphingomyelin. C. Cholesterol. D. Phosphatidyl inositol. The right answer, deficiency of dipalmitoyl phosphatidylcholine causes respiratory distress syndrome in premature infants. Question number 25. Screening for carcinoma cervix is known as option A. Health promotion, B. Specific protection, C. Early diagnosis and treatment, D is disability limitation. Screening for carcinoma cervix is known as early diagnosis and treatment. Question number 26. Which of the following sections of Indian Penal Code (IPC) are concerned with dowry death? Option A, Section 300, B, Section 302, Option C, Section 304A, Option D, Section 304B. The right answer is option D. Section 304B is concerned with death due to dowry reports. Question number 27. Infant mortality rate does not include option A, early neonatal mortality, B, perinatal mortality, C, post-neonatal mortality, D, late neonatal mortality. Infant mortality does not include option B, perinatal mortality. Question number 28. Vomiting occurs in group of children in the night who had meal at noon. The causative agent for food poisoning is most likely to be option A, Salmonella, B, botulism, C, Staphylococcus, and D is viral gastroenteritis. The right answer is the Staphylococcus is the causative agent for food poisoning. 29. Best position for chest X-ray to detect left pleural effusion is option A, left lateral, B, supine, C, right lateral decubitus, and D is left lateral decubitus. So best position for chest X-ray to detect left pleural effusion will be option D, left lateral decubitus position. Question number 30. The commonest side effect of modified ECT is option A, amnesia, B, body ache, C, arrhythmias, D, fracture vertebra. Amnesia is the most common side effect of modified ECT. Question number 31. Which nursing action is a priority for a child admitted with suspected bacterial meningitis? Option A, place the child in isolation. Option B, prepare for a lumbar puncture procedure. C, administer the prescribed antibiotic. D, initiate intravenous fluids. The correct answer is the priority nursing action should be place the child in isolation. Question number 32. A nurse is assigned several pediatric clients which would be first to receive care at the start of the shift. Option A, a child infected with human immunodeficiency virus. Option B, a child with asthma exacerbation. Option C, a child with recent cleft palate repair. And D, an infant infected with rotavirus. So here the correct answer will be a child infected with HIV should get priority nursing care. Question number 33. Which observation indicates that nurse should withhold a scheduled immunization for measles, mumps and rubella (MMR) for a 15-month-old child? Option A, the client has a congenital immunodeficiency. B, the client is receiving antibiotics for otitis media with effusion. C, the client had a temperature of 103.5 Fahrenheit after the last immunization. D is the client's current temperature is 100.5 Fahrenheit. So here the exact contraindication for giving MMR will be the client has a congenital immunodeficiency. Question number 34. During a preoperative assessment of a 2-year-old client undergoing myringotomy. The nurse identifies a risk for latex allergy when the mother of the client reports an allergy to option A milk, B tomatoes, C bananas, D apples. The correct answer is allergy to bananas can cause there will be chance for getting allergy to latex. Question number 35. Which nursing observation would indicate a major complication in a 5-year-old client who is receiving blood transfusion? Option A, temperature of 98.3 degrees Fahrenheit. Option B, difficulty breathing. C, sleeping soundly. D, brisk capillary refill. The right answer is difficulty in breathing is the nursing observation which indicates a complication for blood transfusion in a 5-year-old child. Question number 36. A 3-year-old child with leukemia is admitted to receive a chemotherapy treatment. The child has a white blood cell count of 4,000 per micromilliliter. Which nursing intervention is the most important? Option A, restrict fluids. Option B, administer an antiemetics. Option C, restrict visitors. And D, monitor the client's temperature. The correct answer is option D, monitor the client's temperature, which indicates a sign of infection. Question number 37. Which parameter should the nurse check before administering oral digoxin to a 1-year-old client? Option A, blood pressure. B, weight. C, heart rate. D, potassium level. The parameter a nurse should check before administering oral digoxin for a 1-year-old client will be heart rate. Option C. Question number 38. Which observation made during a school screening would indicate suspected scoliosis in an 11-year-old child? Option A, shoulder symmetry. B, presence of lordosis. C, positive Adams test. And D is presence of kyphosis. For detecting scoliosis, here the thing uh, the Adams test must be performed and it should be positive. Option C is right. Question number 39. A 13-year-old girl is admitted to an inpatient psychiatric unit after attempting suicide. What is the initial nursing priority? Option A, increase the client's self-esteem and promotes her sense of identity. Option B, establish a therapeutic play session. Option C, ensure the client's safety. D, establish recreational therapy. The correct answer is option C, ensure the client's safety is very important for a client who has attempted suicide already. Question number 40. A 5-year-old child is diagnosed with right lower lobe pneumonia. In which position should the child be placed to maximize oxygenation? Option A, high Fowler's position. B, supine. C, right side lying. D, left side lying. The correct position to be placed for a child who is having right lower lobe pneumonia will be option D, left side lying position. Question number 41. Which of the following drug is to be infused fast? A, aminophylline. B, mannitol. C, dopamine. D, potassium chloride. The correct answer will be option C, dopamine should be infused very fast. Question number 42. Which guideline a nurse has to follow when caring for pressure sore? Option A. Wound must remain moist. Options B. Tight packing of the wound. Option C. Plastic sheet type of dressing for cover. D is dressing to dry before removal. The right answer is dressing to dry before removal. Question number 43. Inflammation of tissues surrounding the nail is option A. Clubbing. B. Koilonychia. C. Paronychia. D. Ankylosis. The right answer is Paronychia. Question number 44. What will nurse do in case patient have seizures if alcohol is withdrawn suddenly? Option A. Make patient comfortable and restrained. Option B. Take blood sample for the ethanol level. Option C. Monitor vital signs. Option D. Prevent patient from injury. The right answer is option D. Preventing patient from injury is very important when the patient is having alcohol withdrawal symptoms. Question number 45. Image based question. Name the position which is shown in this image. A. Trendelenburg position. B. Genopectoral position. C. Lithotomy position. And D. Erect position. The right position is genopectoral position, also called as Nature's position. Question number 46. The following are absorbable sutures except option A. Catgut. B. Nylon. C. Monocryl. D. Vicryl. The right answer is except catgut sutures, all are absorbable sutures. Question number 47. Tracheostomy is usually performed between the tracheal rings of cartilage or option A. Second and third cartilage. B. Third and fourth. C. Fourth and fifth. D. All of the above. The right answer is option A. Second and third cartilage is preferred for tracheostomy. Question number 48. A client with ascites has been ordered paracentesis. Before the procedure, the nurse should instruct the client to option A. Empty the bladder. Option B. Eat foods low in fat. Option C. Remain NPO for 24 hours. Option D. Assure the supine position. The right answer is empty the bladder before the procedure. Question number 49. If intubation is indicated in a client with bleeding esophageal varices, the type of tube most likely to be used is option A. Levin's tube. Option B. Salim-Sump tube. Option B. Miller-Abbott tube. And D is Blackmore-Sengstaken tube. So in case of esophageal varices, we use Blackmore-Sengstaken tube. Question number 50. The chief complaint in clients with Vincent's angina is option A. Chest pain. B. Shortness of breath. C. Shoulder discomfort. D. Bleeding oral ulceration. So in Vincent's angina, the chief complaint is bleeding oral ulceration. Here we come to the end of today's 50 questions. Thanks for watching. Subscribe to Satu Career 2.0 online nursing channel to get more good questions video. Take care. Bye bye.